Avinu Shabbat Heavenly Father, bless all of us who have joined here today, either live or virtually, to take part in New York Medical College Department of Physical Therapy's White Coat Ceremony for the class of 2024. Almighty God, Rofei Chol Basar Mafli La'asos, healer of all flesh and wondrous in your acts, you have instructed and empowered humanity to provide relief, comfort, and aid to all of your children. We and all who are involved in the citadel of medical education are your agents in this task. May your abundant blessings always be showered on those who enter the halls of this institution. Give strength, courage, and fortitude to the women and men who now prepare to engage in direct patient care. Bless them as they set out as your agents to serve those in need, those in pain and discomfort, and all those who seek their healing. Grant them the wisdom and the strength to strengthen the weak and to uplift those in despair. As our students begin the actualization of the knowledge that they have acquired, we pray that they constantly remember the principles to which they were educated. May they always recognize each and every patient as the individual they are, and grant them the ability to always acknowledge the interplay of body and spirit and the art of physical therapy. At this auspicious event, we also pray to you, dear God, that you shower your blessing on our students and all their loved ones, parents, spouses, children, and other dear ones who have helped them reach this milestone, who have been there for support and encouragement, especially the last few years when we have all needed to support one another. May God bless the administration, faculty, and staff of New York Medical College and grant them the wisdom, resolve, fortitude to continue their noble mission, even under the most trying of circumstances. Torah University was created to serve, strengthen, and improve your world, dear God. We ask for your continued divine guidance so that no matter the challenge or circumstance, we together can stand and continue to better your world. Amen.
So what a special day. We're so pleased to be together physically in the same room, masks still on, but here in spirit. We're so pleased to have family members and loved ones with us here to help celebrate the class of 2024 White Coat Ceremony. I ask for a moment of silence to acknowledge family members and loved ones who are no longer with us, who are with us in spirit, although not here physically. Today's White Coat Ceremony symbolizes and celebrates our first-year students' transition from students of physical therapy, investing a tremendous amount of energy and time and effort to understand the nature of physical therapy, the transition to their clinical practices. They'll be working directly with patients on a full-time basis. The doctor of physical therapy, that title should not be taken lightly, right? A doctoring profession brings with it a huge social esteem for taking care of others, for being knowledgeable, for being inquisitive, and relentless in trying to provide service to others at the utmost level. Interestingly, the term doctor comes from the term doctus or docere, meaning to teach. So in fact, the students have been training as a doctor of physical therapy for quite a while already. But also in that regard, becoming a doctor of physical therapy never ends. It's an ongoing evolution to higher levels of knowledge, care, and practice. The ceremony today is not so much a celebration of an endpoint, but an acknowledgement of the commitment the students are taking to be servant leaders in serving the need of others. They consider the ethical dilemmas they'll be facing, community-based issues. In this day and age, the idea of social determinants of health, access to healthcare delivery, historically marginalized people. These are all issues facing us today, underserved populations. The white coat tradition actually started as early as the 1800s. It had been actually a black coat because in early historical times, black was the color of formality, of professionalism. Not until Joseph Lister developed practice issues in terms of sanitary practices and hygiene. And Thomas Eakins, a Philadelphia painter, painted a famous painting, the Agnew Clinic, showing physicians in white coats that the tradition changed from black to a white coat ceremony. The first formal white coat ceremony in medical schools began at Columbia University College of Physicians and Surgeons in 1993. when Dr. Arnold Gold suggested that the white coat should be a starting point, not an end point, a reminder of the path being taken. So the ceremony emphasizes and symbolizes professionalism, humanism, and trust. Our tradition here began in 2016. We thought quite a while about a white coat ceremony. In reality, many physical therapists do not wear a white coat. There's an idea of separating clinician from patient. So in some cases, people wear casual clothing and first names to have a tighter link to patients and clients. But we thought about it, and the symbolic donning of a white coat, symbolizing the entering into a commitment, is what we thought was very appropriate. Some schools begin the white coat ceremony when students first arrive. Some have the white coat ceremony at the end of the graduation process. We thought for ourselves here, the transition from first year to the first time full-time clinical practicum would be a great way of symbolizing the transition from didactic classroom work to clinical work. This afternoon, we'll have numbers of speakers giving their perspectives. Chancellor Halpern will provide us some commentary through video recording. The deans are here. We have an alumni to share some ideas about the transition from student. We have a faculty speaker. And a highlight will be the donning of the white coats, assisted by faculty advisors. So we thank you again for being with us in this very reflective, auspicious occasion. And we'll get things started with a video recording, greeting comments by Dr. Halpern, the Chancellor and Chief Executive Officer of New York Medical College.
Hello, my name is Edward Halperin. I am the Chancellor and CEO of New York Medical College, the Provost for Biomedical Affairs of Touro University, and a Professor of Radiation Oncology, Pediatrics, and History. And I cannot be with you in person today, but I did want to accept your kind invitation to speak with you on the occasion of you donning the white coat. I would submit to you today that there are three themes of why people put on white coats. They are a medical theme, a sociological theme, and a moral theme. The medical theme traces itself to the 19th century. In the first half of the 19th century, Ignaz Semmelweis, working in Austria, and Oliver Wendell Holmes Sr., working in Boston, both postulated that you would reduce the risk of puerperal fever, what is also called childbed fever, the development of pelvic sepsis after childbirth. They both postulated you would reduce the risk of that if physicians thoroughly scrubbed their hands and dipped their hands in an antiseptic solution before performing pelvic examinations. Now, you'll remember that examination gloves were not invented till near the end of the 19th century. So people did physical exams in their bare hands. And Semmelweis and Holmes demonstrated that there was some infectious agent being transmitted in the absence of hand washing, which could be remedied by hand washing. The second factor was in the 1860s, Joseph Lister, a British surgeon, read Louis Pasteur's essay on reflections on putrefaction, on why was it that organic material decayed, putrefied, rotted, and that Pasteur demonstrated that this material was being overgrown with bacteria and fungi. Lister started staring down the barrel of his microscope at infected wounds after compound fractures and recognized that this bacterial infection was also occurring in human wounds. So he proposed a novel idea of antiseptic surgery, sterilize the surgical drapes, sterilize the surgical instruments, cleanse your hands, spray an atomizer of carbolic acid solution in the OR to reduce bacterial overgrowth, and you would reduce the risk of operative wounds. It is work like this that led to the association of cleanliness with improved healthcare outcomes, and a white coat conveyed the message of cleanliness and became part and parcel of healthcare because of the work of Semmelweis, Holmes, and Lister. Now, I said there were scientific reasons, and then I said there were sociological and moral reasons. The sociological reasons for wearing a white coat are that it conveys the message that you're part of the guild. If you wear the white coat, you are asserting that you are one of them. You are one of the people of the healthcare workforce, and that this is your uniform, that this is how you define yourself, and that if you wear a lab coat, what some people call the white coat, a lab coat, that is sending the nonverbal message, we're scientific. We wear lab coats, they're clean, but they say we're a member of the guilds of health professions allied with science. The third reason I said for wearing the white coat or moral is that it conveys with it a lot of implied messages. People who wear white coats can be trusted. They know how to keep a confidence. They know how not to gossip about what the patient said or do. It's okay to take your clothes off in the presence of people in white coats. They are safe. They're just there to do a physical and an assessment, and they're there to try to help you, and that all is conveyed by the white coat. Well, for those three classes of reason, scientific, medical, sociological, and moral, you can, each of you, decide what thoughts go through your mind when you put on the white coat. But whatever the reasons are that resonate with you, wear it with humility and with pride. Do nothing to ever dishonor the message sent by the white coat. And in that context, I welcome all of you to that long line of women and men that stretches backward and forward in time, who have devoted their lives to the relief of pain, the amelioration of suffering, and to helping people avoid, to the extent possible, premature death. And I wish all of you, as you don the white coat, Godspeed on this next phase of your educational journey. Congratulations.
Thank you, Dr. Halpern. Dr. Halpern wishes he could be here today. You can tell from his comments, philosophical, historical. He's a great, insightful person who really finds a depth in the symbolism, the traditions. Very proud to be providing care for others, as we all are. So we're very pleased that he's able to share those comments with us here today. We're delighted to have with us also the Dean of the School of Health Sciences and Practice, Dr. Robert Amler. Dr. Amler, thank you for being with us here today. We look forward to some comments from you on this occasion.
I think I'm far enough away. I can take this off for just a minute. My family always says I look better with the mask on. So I'll let you decide what you think. By a show of hands, no, we're not going to do that. It is really, really a challenge to meet up to all the expectations placed on us when we put on this white coat. But an even bigger challenge to follow Dr. Halpern, our chancellor, who I think has summed it up so beautifully, that I'm going to follow the advice of our former president, Franklin Delano Roosevelt, a great speaker, who once said the key to being a great speaker is three things: be sincere, be brief, and be seated. So I will be very brief. Putting on this coat for the first time, I can still remember, actually a long time ago, I can remember how good it felt at the end, not the end, but at the point where a lot of work and study and preparation, applications, interviews, selections, meeting colleagues, working with faculty, trying to master a profession. And now I got to don this white coat. It was many years ago, but I'm sure it's not the same white coat, okay? So you don't need to worry. To don this coat felt so good. And in some ways, it was the peak of personal narcissism, saying, I made it, I did it, here I am. I'm a professional. I'm a physical therapist, I'm a physician, I'm a dentist, I'm a pharmacist, any of these fields. I made it. I feel so good. Mom and dad will be so proud of me. Everybody, my professors will be so proud of me. But that's where narcissism has to end. Because when you put on this coat, it is no longer about you or me. It doesn't matter that I had a tummy ache when I got up this morning. It doesn't matter that it's a little too early in the morning, or last night got into a fight with somebody, or had some other issue, traffic, whatever it is going on in my mind. When you walk up to your patient, this coat says, you're there for them. You're there for them. And whether they're short or tall or too big or too small, funny looking, whatever it is, you're there for them. And you're there to help them get through whatever issue they have come to you for. And as Dr. Halpern said, the white coat represents that you can be trusted by the people you talk to when you're wearing this white coat, because you left your narcissism outside the door. It'll always be there. And don't worry, it'll be there for you when you leave the patient. You could still feel very proud of what you accomplish. But this is not about pride. It's about trust, and it's about dedication to this guild, this very noble profession that we all serve for our careers in helping others and allowing them to get the best health outcomes possible. I finalize these remarks with a quote that comes actually from our military services that says, whatever challenges you encounter, there's a 3-word motto of how you can approach those and get to where you need to be with your patient, with your profession, and with your peers. And that is, and some of you who've been military have heard this before, improvise, adjust, and overcome. Because there will be many, many challenging patients and clients down the road. With the help of this white coat and the dedication you carry with it, you will overcome every single time. Thank you.
Thank you very much, Dean Emler. We're also pleased to have with us the Vice Dean of the School of Health Sciences and Practice, Dr. Ben Johnson. Dr. Johnson does not have a medical degree. He has a EDD, and his expertise is in movement sciences. So he doesn't always have the same color scheme, but he's got the same soul. So we're very pleased to have.
Well, you made it to the end of the non-physical therapist, and I'm going to try to elicit a little bit of sympathy out of you. Every darn time we do one of these ceremonies, I have to follow the rabbi, the chancellor, and the dean, all of whom are great speakers. And so here I am today, faced with one more time to have to speak. And this time all the parents and loved ones are with us. So welcome to everybody. I'm not a physical therapist. I'm not a medical doctor, as Dr. Majak said. I've never had a white coat. When I was in grad school, I was a biomechanist. You all know what biomechanics is, right? All my exercise physiology friends had white coats. And I'm beginning to think now that I chose the wrong field. I should have been an exercise physiologist so I too could have a white coat. But having been a professor since 1985 in exercise science and sports medicine, I know the the science that undergirds your preparation in this field, and I know the challenges that you have. You should be very proud of yourselves that you've gotten to this point, because the sciences that you must master are very complex. And I know that this department chooses the best of the best students, and you all have excelled. And now you've reached that point where you've somewhat mastered those sciences and you're ready to go out and practice all that you've been learning. So I congratulate you on that. You know, I'm sitting here looking at you and I realize that, Dr. Majak, I don't really recognize any of these folks. And I'm not sure if it's because they have masks on, or if because they're so dressed up, or I just haven't seen them on campus because I haven't been here in a year. So thank you for enduring this crazy COVID situation. We are all eager for it to be behind us. So please go out and conquer the world. Congratulations.
We'll go Tar Heels. Oh my gosh. I'm a Duke graduate. He got into almost a real school, Chapel Hill, but bit of levity. We have an amazing faculty. You know, I mean, I think that we're all challenged by COVID, you know, and the students, what they did to be here and to learn under these situations was really quite impressive. I can tell you, seeing behind the curtain of the stage, what the faculty did to transform their teaching into online teaching, to learn new technology, to be available for emails and challenges, just astounding. I'm so proud of what we did as a team of faculty to aspire to have the same, if not a higher level of quality of education in these trying times. So we really are an educational community working really hard to make our best efforts go forward. Because of that, we always like to have a faculty speaker at the ceremony to give a sense of faculty perspective. I'm very pleased that this year, Dr. Christina Wellsome is going to share her perceptions representing the physical therapy faculty at the ceremony. Dr. Wellsome.
So one of the biggest challenges of teaching and speaking with COVID is your glass is not fogging up. And usually we have face masks on as well. It has been my distinct pleasure to get to be working with all of you over the last 3 semesters as you start your clinical careers. I've seen each one of you grow in immense ways as an individual and as a clinician, and I'm really excited to see you go out into the clinic. So that comes from me. And as the faculty rep today, I decided that what I wanted to share with you was to make sure to honor each of the other faculty who are not speaking with lessons that they have taught me along the way that I think are important for you to carry out into the clinic as you go. So I'm going to start with Dr. Majak. Dr. Majak talked to you about the environment that you put your patients in, right? Making sure that they get that experience of stepping over things, walking around things, and motor control. And I think that sometimes life throws brick walls up in front of us and our patients. And when that brick wall comes in front of us, it is a challenge. And sometimes we can look at it and we could, throw ourselves on the floor and cry in defeat. But that's really not an option for us because we need to be there for our patients or our clients. So we can choose to learn a new set of skills. We might have to adapt and go around that wall. We might have to learn how to climb over that wall. Or sometimes we might be able to recognize that that wall was put in front of us. Maybe it's to protect us and our client, to keep us from going the wrong direction. And so we might actually have to stop and turn and go the other way. So I wish you that wisdom to know when you face a challenge that you're not going to give up. From Dr. Ronan, we wear our white coats, but often as therapists, we have to push up our sleeves, take them off entirely, kick off our shoes, climb onto the mat table, get on the floor with children, be on a hospital bed, and I won't have to remind you of all the things we might find in acute care, right? We've talked enough about that. I know it's your favorite thing. But Dr. Ronan, I think, has always reminded me to be prepared, to get ready to get in there and to do it with integrity and safety, to know that you are there for your patients and that their needs come first. So keep that in mind as you work with them. Dr. Curtis would remind you to never forget your heart. It's probably the most important organ that you have, and it needs to go with you into the clinic. I told you in cardiopulmonary that your patients are not going to care how much you know until they know how much you care. And I really honestly want to stress that too again. And I know that Dr. Curtis has reminded me of that since she was my professor at Columbia way back when. So I learned that lesson from her. You would never know it because she's so tiny and she looks so young, right? The other thing I want you to remember is that all the discussions that you've had about genomics and lifestyle medicine in all of the courses, that you really want to nurture the nature of your clients. Yes, there are genetic factors in play, but the environment that you put them in decides whether those genes get expressed. Dr. Lavender has taught me about the value of spirituality. I remember when she came and interviewed here, and she gave us this beautiful talk about having soul and spirituality in healthcare. And I think that I want to remind you to not lose your faith, because patients are going to come to you on their darkest day when they have lost their own faith, when they don't believe that they can overcome the barriers and boundaries that are in front of them. And sometimes you're going to need to lend them your faith. So help them remember their belief in God, the divine, creation, a higher power, themselves, or let them borrow yours when they need it. From Dr. Delat, I want to remind you the value of creating relationships and having good communication with your clients. The work that we do with our patients, we don't do it for them, we do it with them. We work in partnership. We don't tell them what to do and they follow us. We can lead by example, but we really need to get in there and find out what their goals are so that we can help them set that goal and that intention for that transformation we want to see occur with them. And so you need to communicate with them, and you need to be able and willing to listen to them and create that space so you can create that partnership and that relationship. From Dr. Gavronsky. She's worried about what I'm going to say. Dr. Gavronsky has this amazing ability to innovate and evolve. She is always the fastest one with the technology. So, we as physical therapists, we work a lot with our hands and our eyes and our bodies, right? And we work with the bodies of our patients. But the technology is there, and you guys have that ability to see that with fresh eyes and to take it to the next level. And I love when she sees that in you, and it reminds us to see that in you as well. And also reminds us old dogs can learn new tricks too. So I appreciate that. I think I got everybody. Let me make sure. Okay. And Fran, you guys all know Fran. She is the glue that holds us all together. Just as you're going to be the glue that holds your patients and their families together. So remember that while you might not be seen, you might be glue that dries invisibly, but you are still there and part of the healing process for them. So when you show up to treat those patients, remember your stages of behavior change. They might not be ready to face what is going on. They might not be ready to change, even though you're ready to jump in and get them exercising and get them walking and get them moving. Don't forget to take your vitals, please. And you are not there to heal or fix them. You are there to work with them, to partner with them for that transformation that's going to occur in their life. And that is what our profession is all about. And that transformation is going to occur within your patient, but you are the catalyst that's going to help that transformation occur quicker. And the important thing about a catalyst, for any of you that are chemistry majors, is that catalysts don't get used up in the reaction. So I want to caution you for all that you are going to give out there to your patients and your clients and their families and their loved ones. Don't let yourself be burned up or burnt out, because we need you to be here for a long and happy career. So I'd like you to enjoy your time in the clinic. I want you to bring joy to your patients. I'll miss you, and I can't wait to see you guys back. Good luck out there.
How generous, Dr. Wilson, to be sharing the whole perspective of the team. It was very nice of you to kind of expand your comments to everybody. I will say to the students, you've heard the perspectives of many people here. The key is become a better version of you. We all aspire with our goals, with our attributes. Maybe you're inspired by some of us here today or by clinicians you've talked to, you'll be seen. Remember, it's about you becoming a better version of you. You learn from others, but it's about how can I optimize myself with my skills to be a better version of me. Okay. A very meaningful part of the ceremony is we like to have an alumni with us to talk about their transition from a student at New York Medical College into a doctorate of physical therapy. We're so pleased to have with us today Dr. Dominique Torres, a graduate from the New York Medical College class of 2015. He's been involved with us in going to Haiti for service. He's a senior therapist at Mount Sinai Hospital in New York City. He's just a really nice person too. So I want to introduce Dr. Dominique Torres. He's going to give some thoughts about his time here and how he's transitioned and some lessons learned along the way to becoming a doctor of physical therapy.
Hello, everyone. Good afternoon, distinguished faculty, guests, family and friends, online viewers, and welcome class of 2024. When I was informed that I have been selected to deliver a keynote speech for this event, I felt very honored and humbled, as well as a little nervous. My palms are literally sweating right now, just like in any practical exams looking back. Eager and excited, are reminiscent of exactly how I felt 10 years ago in 2012 when I started my journey as a physical therapist. It is an absolute privilege to be with all of you tonight, and my hope is to share with you my heart, my experiences, and offer some bits of wisdom that has been imparted to me throughout these years that I believe is very timely and relevant to help you with physical therapy and hopefully in life. Today marks a very important milestone and academic ritual in our profession. This white coat ceremony signals the transformation of your status as an ordinary student to that of one studying to become a health professional, a doctor in physical therapy. Thomas Edison could not have said it any better. The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in a proper diet, and in the cause and prevention of the disease. This quote ties into my first nugget of wisdom I'm sharing with you tonight. And I just have 3, I promise. It is never too early to reflect and discover your why. The why of your core value and purpose. Why? Why are you in this profession? The next few years of PT school is going to be very challenging and will test your limits. I truly hope that throughout your journey, you can see beyond getting the 4.0. I did focus on it quite a bit, and work deeply on your goals and purpose in picking this career. My purpose didn't come quite easy for me compared to others. Physical therapy is a second career. Before that, I fostered in the world of accounting and finance, although a very good and thriving career, but my heart was not set into it. And thank God I switched and could not be more happier. The why of my purpose in physical therapy is the humanistic connection we have with our patients. As doctors of physical therapy, as Dr. Walsam alluded to, we are one of the few that will know the awesome privilege and responsibility of caring for the sickest patient in their darkest hours. Imagine treating a C-level spinal cord injury patient and seeing them go through the denial, anger, bargaining, depression, and acceptance phase, all in an hour-and-a-half session in acute rehab. And that will certainly teach you empathy, active listening, and compassion. You will also be moved and humbled by the trust that your patient placed on you. Will I get better? Will I walk again? These are the questions that you will encounter ever so frequently. And sometimes you'll hear those echoes in the wee hours of the morning. So your mind and your heart should be fully set into it. I encourage everyone to really dig deep and find out what you hold most valuable and how that fits clearly into your why moving forward. Once you've clearly figured out your why, this connects me to my second nugget of wisdom. And that echoes completely from the American Physical Therapy Association vision statement, which is transforming society by optimizing movement to improve the human experience. Let me emphasize these 2 statements because I love this. Transforming society and improving the human experience. Now, more than ever, the need for all physical therapists to adapt to change, evolve, and develop a global perspective is tantamount to the success of our profession at large. The magnitude of current events, the global pandemic, Medicare cuts, racial and health inequalities, war, environmental change, the list can go on, all impacting the overall human experience can no longer be ignored. In order to optimize movement, as we are movement experts, all physical therapists should be adaptable to change, plain and simple. Never would I have imagined that I will be evaluating and treating a patient in a makeshift tent in Central Park during the pandemic while speaking in Spanish. Or would I ever see myself teaching a patient use a wheelchair for the first time in a mobile clinic in the mountains while speaking French Creole in Haiti? Or lastly, instructing a patient with an exercise regimen for a patient with stroke using telehealth. The examples that I provided to you are just the tip of the iceberg and highlights the importance and need of diversified thinking. As our society transforms globally, our passion for movement to improve the human experience should evolve as well. As I stand here tonight, I am reminded as to how it all started when I was a student here in these very four walls. How rigorous our D.P.T curriculum was and how much sweat and tears, and oh boy, there were plenty, I have poured onto our exams and PBL learning. It is both a humbling and empowering experience of my life. And this brings me to my last nugget of wisdom, and that is humility. The word doctor is indeed a great title and privilege for our profession, but at the end of the day, the sanctity of the therapist and patient relationship must be upheld. I always tell my students in the beginning of their affiliation, being smart will get you through your chart reviews, but having a humble heart will make you a great therapist. Humility is showing empathy, active listening, really listening, and compassion so that we can empower our patients on a daily basis. Humility is also admitting that you don't have the answers. You don't know what you're doing, and you need help. I urge all of you to be open to constructive feedback in all your affiliations and in life, and actively seek mentorship as early as you can. Look at our professors in front of you. They are the best mentors you currently have right now. Learn and absorb as much as you can from them. They are the best resources for your career and in life. Class of 2024, as you stand here tonight and don your white coat, I want you to reflect upon what the responsibility of wearing this white coat entails. The responsibility to stay noble and humble, the responsibility to not give up on our patients and think globally, and the responsibility to always pay it forward through service. We are all fortunate to be in a profession that is both empowering and challenging, and I sincerely hope that when you look back on your journey a few years from now, you can still have the same energy, commitment, and dedication with this career as I still have. Congratulations, everyone. Before I end the speech, I would also like to do a quick shout out to the D.P.T class of 2015. We didn't have a white coat ceremony then, so I dedicate this special night to all 31 of us as well.
I just don't know what to say. I mean, Dom, that was fantastic. I think you captured so many emotions and messages in your words. I never knew you could speak that well. Some really deep feelings, and I think that it shows a commitment. You mentioned global dedication numerous times and humanism, and boy, if this wasn't the time to need that with our current challenges. So thank you so much for such an elegant set of words and expressing your emotions here today. It was really, I'm very moved by what I heard here, as with all the speakers. As a component of coming into the program, the students that arrive are assigned to a faculty development advisor, professional development advisor. We track their academic abilities. We meet during the semesters in terms of professional development, issues such as stress management, communication, critical thinking. We're deeply committed to helping the students to appreciate the culture of physical therapy, which is quite different than a lay person's undergraduate, more laissez-faire environment. We have got people who expect a different kind of behavior. And so it's a big change sometimes to leave a lay person casual world and to appreciate the importance of the words you choose, the appearance you put forth, the way you engage with people. And so we're very proud to be involved with that sharing and evolution. To do that well, again, the faculty put in a lot of time in terms of monitoring, mentoring, advising. So I'd like to introduce the faculty, and as they come up, they're going to come up and face the audience because they'll be assisting the students with the white hooding. So faculty, you can just kind of come straight up and turn and you'll be right in your perfect positions. But Dr. Catherine Curtis, if you want to clap, you can clap for them. Dr. Janet Delott. Dr. Nikki Goronsky. Dr. Gail Lavender. Dr. Susan Ronan. Dr. Christina Wilson. And not by words alone, but not Dr. Francesca Menta, will you join us for a second on the stage? Come on up. So here's the team, folks. Thank you very much. It's my pleasure to announce the names of the students as they come up forth to be assisted in the donning of their white coat. We have it lined up so that the students will be donned by their professional development advisor. So I'm going to call up groups of students. By group, they'll walk to the left-hand side of the auditorium as a group, and I'll call out names individually. They can then progress in front of their advisor. They will face the advisor. They'll extend the white coat to their advisor. They'll turn around. The advisor will put the coat on. Then they'll give a culturally appropriate acknowledgement of success, whatever that may be for the student. And then I ask that you hold your applause until we have the whole group up with the white coats on. We'll give a group applause at the end of the grouping session that way. Will the first group please proceed to the left-hand aisle with Francesca? So the first group is Enes Azarwari, Jeffrey Allegan, Devante Arujo, Baldwin Ayujo, Yahia Shaheen, and Dean Cucciarillo. You may take your seats. Same way. And the second group come across the aisle and come across. First group went this way. We're just going to kind of weave around. Christopher Guski, Flor Ayarova, Sarah Bonosia, Noel Capuno, Nasreen Jabrakil, and Lauren Durham. For the group that Kaylani Jones, Natasha Darwala, Victoria Corralo, Jacqueline Grant, Justin Park, and Alex Elliger. Thank you very much. Marissa Lemery, Rezo Erdman, Menyal Lu, Shayna Kronish, Nicholas Pellegrino, and Jonathan Halbul. Thank you. Christian Orlando, Caitlin Flippin, Michael McWilliams, Sarah McKay, Sarah Steer, and Nicholas Marte. Thank you. Abigail Rosenberg, Richard Martucci, Carissa Stockdale, Mackenzie Swanson, Jonathan Torres Enriquez, Xinyu Yang. Thank you. Noah Odell, Jan Villarosa, Hannah Weaver, Stephanie Watson. Thank you. And our last group of four. Christina Skrep, Derek Yang, Daniel Zukowski, and Lindsay Woolman. Thank you very much. And thank you, Francesca and faculty. You may take your seats. Can I have a round of applause for all our students today? As part of today's proceedings, our students attest to their dedication to ethical and professional physical therapy practice by reciting the pledge for physical therapy, which is found on the back page of the program. Dr. Janet Delott has the pleasure of leading our students through the pledge for physical therapy. We invite all physical therapists in the audience to stand as well and join us in the pledge.
Congratulations, class of 2024. Welcome, family and friends. So first, a little background about the oath. So in 2004, the House of Delegates of the American Physical Therapy Association resolved to support the use of a professional oath or pledge for students in accredited physical therapist education programs and for licensed physical therapists. This pledge serves to enhance the commitment of the physical therapist professional to the patient, client, and themselves. To the APTA Professional Vision 2020, to the Code of Ethics, Guide for Professional Conduct, and Standard of Practice, which have set forth principles and guidelines for professional behaviors, as well as the core values of the physical therapy profession of accountability, altruism, compassion, caring, excellence, integrity, professional duty, and social responsibility. At this time, I ask all of our physical therapy students to stand. You already are, so that's easy, and recite this pledge, but I'll lead you through it. And Dr. Majak already invited all the other physical therapists. So as I enter the profession of physical therapy to practice as a physical therapist, I solemnly and willingly pledge the following. I will respect the rights and dignity of all individuals and will provide compassionate care. I will be trustworthy towards my patients and clients and in all other aspects of physical therapy practice. I will place the welfare of my patients and clients above my own self-interest. I will provide accurate and relevant information to patients and clients about their care and to the public about physical therapy services. I will exercise sound judgment and comply with laws and regulations that govern physical therapy and protect the public from unethical, incompetent, and illegal acts. I will maintain professional competence and promote high standards for physical therapy practice, education, and research. I will address the health needs of society and strive to effect changes that benefit patients, clients, and the community. I will respect the rights, knowledge, and skills of colleagues and other health professionals and seek consultation whenever the welfare of the patient or client may be advanced. Thus, with this pledge, I freely accept the responsibilities that accompany the practice of physical therapy. Congratulations.
Thank you, Dr. Delat. And again, congratulations to the class of 2024. Before I conclude the program, I'd like to ask an applause from the students. As I turn the page, I should know this, right? And as the class of 2024, acknowledge the families, friends, and loved ones, both here and those connected by live stream in spirit, who support the class in their endeavors. Thank you for letting us borrow your loved ones for 3 years. We'll give them back to you. Different, but it's our honor that you trust us with the well-being of your loved ones and your children and your members and your siblings. I also ask that we acknowledge Rabbi Fogel, Dr. Halpern, Dr. Amler, Dr. Torres, Dr. Johnson for the remarks and presence here today. And also Francesca and Michelle Novotny, and I think Stefania was up there in the front room there, as well as Michael Cotter, Michael Frankfurter, Juan Castro, all the folks who made this happen. This is a lot of work and background activity. So thanks to all the supporters and the staff who made this possible today. I'm going to formally close the ceremony. We're going to do the following. We're going to have the class come here on stage for a group photo. We're going to have the university take some photos first. If families want to follow that, you can stay here and take those photos here for group photos if you'd like. If you've had your fill, we'll see you in the lobby for individual celebrations and photos and pictures. When we're done with the photos, we'll have the students walk out on the left-hand side and exit it out. So families and friends, thank you for being here today. Students, congratulations. I now hereby close the ceremony.